Good afternoon, everybody. Happy New Year. Thank you for joining us once again as we continue to work with our local providers to update you, the community, the surrounding southwestern Vermont area, and bordering towns and states that feed into southwestern Vermont. We're broadcasting because we have the capability with Cat TV. So first we have to thank Cat TV, as always, for being our community partner, being able to broadcast this live on Facebook as well as on their TV stations. And this will be recorded and be available afterwards as well. And joining us, as they have all of last year and now into this year, is Southwestern Vermont Medical Center, and specifically their Chief Medical Officer, Dr. Trey Dobson. Trey, thanks for joining us again. And here we are, another year and still the same problem.
Absolutely. Over 300 days since this pandemic started.
Yeah, so we want to hop right in, and I think we want to focus this session on really, I think the last one we started to talk about the vaccine rollout. We want to give the community an update on vaccine rollout, how that's going, as well as we've heard a lot of new things, variants and struggles to get the vaccine out and people not taking it. So we want to spend some time with you to help educate our community and help educate the people watching far and away too. So again, always appreciate having you guys as a partner in this challenge and in this battle. Also, if you are watching on Facebook, and we'll mention this a couple times through, please leave your comments and questions for Dr. Dobson. We will try and get to them. We are monitoring them. And so this is a great way that we have found in a COVID world to interact with our community. And so we have a couple questions here. We've had a couple questions stream in before we went live. And we will try and get to all the ones that people leave on the page as well. So thank you for joining us, and let's hop right in there, Dr. Dobson. The first one I want to ask is, we were talking before we went live here, and I think it's just kind of fascinating and good for the community to know, how has Svmc received the vaccine? There are different ways to receive it. Either by the state, by Pfizer or Moderna, or a combination or a hybrid of both. So talk to us a little bit about the infrastructure of how the hospital is receiving these vaccines.
Absolutely. Well, so as you know, there are two vaccines that are approved under the emergency use authorization, the Moderna vaccine and the Pfizer vaccine. And it's really a coordination at the federal level with the state level. And then the Department of Health here in Vermont then delegates how and where that vaccine goes. And so right now it's all going primarily to the hospitals and to certain pharmacies that have arrangements to vaccinate skilled nursing facilities and long-term care facilities. So what happens is the feds basically talk to the state, let them know each week how much vaccine they are receiving, and then the state level divides it up to the hospitals. Now, we're very fortunate here at Southwestern Vermont Medical Center because back in May, and I think we mentioned this last time, Matt, we had seen the writing on the wall. We could see that the vaccines that were being produced, that some of them at least would require ultra cold temperatures. And by that, I don't mean a freezer. I mean a freezer that can go down to 70 degrees, minus 70 degrees Celsius, minus 90 degrees Fahrenheit. And those are not easy to get a hold of. So we started looking around and we put some purchase orders in, and they arrived in late fall, early winter, and we've just held them. And so now that this vaccine is out, we're able to actually be a storage unit. There's about 5 or 6 in the state, locations, including the health department itself, where you can store these one of these vaccines for long periods of time. Once you thaw it, you have to give the vaccine within 5 days. So many places, they receive a shipment of vaccine and they just have to administer it within 5 days, no matter what, or it would be wasted. And we're very fortunate in that we can actually now receive it directly from Pfizer in Michigan. So it comes from Michigan straight to Southwestern Vermont Medical Center, and then we can store it. We don't want to store it; we want to give it to people, but we can store it as we're divvying it up. That being said, it is still controlled at the state level right now, so it doesn't give us a whole opportunity or a whole lot of opportunity to receive much more than other locations. It just helps a lot with the operations. In the future, it will allow us to receive as much as we want.
Great. And let's talk a little bit about how that distribution is going. When did you receive the first vaccine? And since then, how has it been being deployed?
Yeah, well, it's been great. Despite some of the information you hear in the media at the national level and at the state level, certainly whenever you undertake such an enormous operation, and believe me, this is enormous, there's going to be some hiccups initially. There's going to be some learning. And what's a real marker of success is, can you learn from those things and be quick and agile in putting in place processes that improve the situation. So we received vaccine here 22 days ago on December 16th, and we began administering it that day, actually within hours of receiving the vaccine. And it was slower than we had hoped at first. The mixing, the moving the vaccine from the freezer to the vaccine distribution clinic, making sure we have people register, making sure that we can push that information to the state, because we have to do that so that they know who's been vaccinated and so that people's doctors know that they've been vaccinated. But every day we've improved that. So right now we've vaccinated over 1,500 people. That's a lot of people. But the rate per day has increased significantly. So we're now over 200 people per day for the last several days. And it seems to be something that we can stick with and attain. And so we are ready when we start vaccinating the public to get large numbers of people coming through.
Yeah, and so are you running into additional challenges and barriers, be that from national warp speed to state Vermont? I mean, we just talked a couple minutes ago about receiving it somewhat directly from Pfizer. Are you running into other barriers and challenges that you're finding?
We aren't receiving as much vaccine as we hope. That's, of course, the headlines in the media. The truth of the matter is, we knew we wouldn't receive a lot of vaccine right away early. We knew that they began producing this vaccine in large quantities in probably October, even well before it was approved, but it still takes time. And their manufacturing is just ramping up. So we knew that the quantities would be limited. I think everyone did. It's not a surprise. It might be a little bit less than we had anticipated, but it's going to increase significantly. So right now, that's why it's being done in phases. That's why there's some prioritization, which we can talk about in a little bit, going on. We are fortunate in southwestern Vermont that we are open to all healthcare workers, first responders, law enforcement, and then of course all of the residential homes and long-term care facilities. And we're actually a good 3/4 of the way through those individuals.
That's great. Last time we had talked about the phased approach. Can you clarify who has and is currently receiving the vaccine? We talked again a little bit about frontline healthcare workers. Has that changed? What does that phased approach look like?
Well, it has changed a little bit since we spoke last, and one thing's for sure: the next time we speak, it will have changed some more. It's not necessarily a bad thing, though. A lot of the changes have to do with experience and learning, and again, back to what I said earlier, making sure that we can respond to those and change strategy. I mean, that is a marker of success, is to change strategy when you see something isn't working well. So initially, the recommendations from the federal government, and these are just recommendations, and they want it to vary depending on the circumstances in your area, but the recommendations were a lot of prioritization based on people's professions, based on healthcare conditions, even socioeconomic reasons to prioritize. But it's just turned out that prioritization significantly slows down the rate at which we can vaccinate. And believe me, I mean, I'll show a slide in a minute on this, but if we prioritize too much, this vaccination program will go on way too long before we can reach that herd immunity that we need in order to pull ourselves out of this mess. So, I will tell you, this has been in the media a lot, but Israel went through the same thing when they started vaccinating a few weeks ago, and they recognized that they were trying to prioritize. It was slowing things down. They just dropped the prioritization and said, let's reach out to people who may have access issues. Let's reach out to the disadvantaged, but we're not going to prioritize. We're going to vaccinate anyone and everyone we can based on supply, and it's increased their rates significantly. I think they're near 15%, and that shows what happened. We're not near there yet here in the States, and we're not there in Vermont, but we are every day improving rapidly. So we're going to be moving towards this age banding.
Talk about a little bit of that. Governor released a couple days ago the aged brand.
Yeah, so we had this initial phase where we said, look, we know that skilled nursing facilities are incredibly high risk. We know that doctors and nurses are seeing COVID patients on a daily basis and are at risk. Let's get them vaccinated. But then after that, let's move into these age bands. So we'll say 75 and above. I'm just going to say that I anticipate that to begin in early February, maybe even a little bit earlier, where all those 75 and above are open to be vaccinated. And then fairly quickly after that, when I say fairly quickly, within weeks, then it may move down to 65 and above, and it may move down after that to 55 and above. Whether it's in 5-year increments or 10-year increments, that's being worked out. The good news with that is it's also very risk-based. I mean, in truth, the worst, the deaths and the hospitalizations tend to be in the elderly, so it is in a way prioritizing. Also, high-risk medical conditions tend to get worse as people get older. So it's more common that someone who's 65, they could be very healthy, but it's more common that illness occurs in patients that are older as opposed to younger. So if we use age bands, they're very objective. There's no question. You're either 65 and above or you're not. You're either 55 and above or you're not. As opposed to using things like profession or healthcare conditions, which can be quite subjective. Cause a lot of division as people are trying to prove whether or not they meet certain criteria, and it just slows the processes down, unfortunately.
I want to remind our viewers, if you're watching on Facebook Live, we have a couple more questions for Dr. Trey Dobson with Southwestern Vermont Medical Center. But if you have a question and we haven't gotten to it, please put it in the comment bar. We will try to get to it, which we tend to usually get to most of them. So when we look at anaphylactic associated with the vaccine, is there anything to worry about that? We've kind of seen a couple where we've been hearing reports about that anaphylaxis associated with the vaccine. What's that all about?
Well, so it's real that whenever you administer anything, and I don't mean just vaccines, I mean any type of medication, and even non-medications, there are small percentages of people who unfortunately have a severe allergic reaction. What the CDC released yesterday is that so far in the United States, several million people have been vaccinated, which is pretty amazing, right? Because the last time we talked, 0 had been vaccinated. So now several million have been vaccinated. And of those, 21 had a reaction that meets the criteria of anaphylaxis. In other words, they were having an allergic reaction that required administration of a medication to counteract that. So that actually gives a rate of about 11 cases of anaphylaxis per million people that are given the vaccine, which is still an incredibly low number. We do not have 1 million people in the state of Vermont, so theoretically that means 0 to 1 persons would have an anaphylactic reaction. The good news is as an emergency physician, I can tell you I treat anaphylactic reactions not to vaccines, to everything. And we know how to treat them. And for the most part, it is rather straightforward and people do extremely well. It is a life-threatening condition if you're not around medical care. And that's why not only in our site, but in any site that's administering the vaccine, we have the epinephrine ready to go. We have the other medications ready to go. And it's we're watching people, and it's a safe process.
Great. I want to hop over to Facebook for a little bit. We are getting some comments there, so we'll kind of go back and forth between some of our pre-script questions. But from Wanda, is there a way to register so I can be on the list? And I've had this conversation with a couple people now, just even encouraging them to reach out to their personal physician to say they are interested in the vaccine. Can't hurt to give a phone call like that. But Wanda wants to know, is there a way to register so I can be on a list when I am eligible to get that vaccine?
Yeah, so at the moment there's not, and I can't say this definitively, but I imagine there won't be a list, Matt. I imagine it'll be done by age bands. And I know that it makes such sense that people want to reach out and be on a list, but it turns out that just managing that list takes our nurses and doctors away from what they're trying to do, which is vaccinate. And whether or not someone's on a list or not, we're going to still offer them the vaccine. So by doing it by age bands, again, it's objective, it's not subjective. If someone doesn't want to get vaccinated, then they don't come in. But if they do want to be vaccinated, there's no reason to try to go through a list and manage that. Now, people have to think through that, because common sense would say, sure, you should have a list and that would help. There are places taking lists. There are some states that are doing it. I believe a lot of it is just to keep people active and engaged, but it doesn't really add value to what we are doing. And that is, we're trying to vaccinate a large percentage of the population as quickly as possible.
So let's talk about some people that might be hesitant about the vaccine. And we've probably had this conversation 2 or 3 times now, Dr. Dobson, but probably worth having one more time with the audience that we have on. What would you say to people who are hesitant to get the vaccine at the current moment?
Right. Well, the first thing I would say, and I always say, and I mean it, is I hear you. I understand your concerns, and I applaud people's ability to make their own individual decisions, and always will. I will say with vaccination, a couple of things. First off, it's very safe, and the things that people read about are not biologically plausible, and they're not real. They are conspiracy theories. The second is that COVID kills. And if COVID doesn't kill you, it will kill a family member or a friend. So this vaccination choice is not all about you. And in fact, it's about 50% about you, and it's about 50% about the family and friends you come across. And then finally, and this, people find this interesting, but it's incredibly real. If you do not get vaccinated, then you will get COVID-19. Let me just say that again. If you do not get vaccinated at some point, not tomorrow, but not 20 years from now, you will get COVID-19. It's ubiquitous, it's omnipresent, it's everywhere. And if you're not vaccinated, then your chances of getting the disease are incredibly high over time, because at some point you're going to come across it. If you're okay with that, then you're okay with that. I will tell you, it's not good to be okay with it. We're learning every day about young people that get the virus, they get over it, they think they're fine, and they have long-term memory deficits. They have neurologic components. They have depression. They have all kinds of things that we would not want you to have. And vaccine is incredibly safe, and it works. Now, it's not 100%. Nothing's 100%. So if not a large percentage of the population, or I should say, if a small percentage of the population gets vaccinated, that doesn't help the situation much. We need that 80 to 90% vaccination in order to really protect everyone and be done with this mess of wearing masks and staying away from each other.
Great. Oh, that's terrific. We've got a couple more comments on Facebook I want to make sure we get to. Scott asks, are there younger people, with predisposed health factors? Will they be prioritized through the possible pre-registration, which I think we answered, or are they just going to be left in limbo until they eventually reach their age bracket?
Yeah, no, it is a really great question. I am going to say that I'm going to have to go out on a limb here, and Scott's going to have to recognize that there are some variables that I don't have control over, and one of those is vaccine supply. But assuming supply increases, which let me just reiterate, we do believe is going to happen, manufacturing is increasing, as well as the introduction of new vaccines, then those with high-risk health conditions that are younger, we should be able to bring them in earlier than they would have gotten to with their age band. Again, this is being considered at the state level, and the recommendations have not come out. I do think they will. It may not be right away on day one with the 75 and above, but it may be weeks or a month later. And what Scott is saying is true. If we can prioritize those folks, we should.
Okay. Another one from Virginia. I've been told that it's recommended that if you that you don't get the vaccine if you're allergic to eggs or penicillin. Is that true?
It's not. No.
Okay. Easy one.
Easy.
So,
the only contraindication, Matt, to COVID-19 vaccine is an allergic reaction to COVID-19 vaccine.
Okay. So Virginia, hopefully that answers your question. Thank you for tuning in, and everybody for leaving those comments. Please, if you continue to have questions, leave some. Let me just go back to some of our questions, and as we start to look at this vaccine, and what I'm hearing is we want a stronger, faster, safe way to administer this. Any more details regarding any development of community vaccine clinic?
No, that's a great question. So yes, details are starting to come together. Let me just give a bigger picture. It will be something along the lines of what we've seen in these large testing pop-up clinics that the state have done so successfully, where they put up a clinic, whether that's up north in Manchester and down in Bennington, for example, where we can get large capacity, large numbers of people through there. And it's likely that it'll be some combination of the hospital here at SVMC working together with the state to use National Guard supply and other staffing resources. We've got locations. We could do either on the campus at the hospital, Southern Vermont College, Bennington College, the airport. There's all kinds of places. So we're good in that regard. The state is just finalizing the plans, and once they announce those, we'll be ready to go. It's likely it will be. I saw one of the questions is why can't we do it as a drive-up? It is likely it'll be a drive-up very similar to what we did with flu vaccine this year. It is likely that we will have online registration as we do now for the healthcare workers. It actually works really well. It works as you would anticipate and hope. You just go online and you sign up. And so that is what we envision, barring any unforeseen barriers. And the start date on this, just again, actually maybe just real quick pull up the slide that kind of shows.
Yeah, that'd be good.
Matt, this is a timeline slide here that that gets updated regularly. As you see, I updated it today. You can tell in the bottom left corner, January 7th, but this goes into the phases. And what we imagine is these age bands beginning, at the end of this month, early February, and we start those at these large-scale clinics. Scott was asking earlier about the high-risk medical conditions. That's the green section, which we believe will start somewhere at the same time or maybe a little bit delayed. Again, not sure on that. We'll have to hear from the state. We're ready to do whatever is recommended. And if the supply is sufficient, like we think, this could be really done in, I have it going through July, but it's possible it could even be well underway in May and June, again, just depending on some other variables there.
Question, Dr. Dobson. So this is kind of your timeline, maybe even Vermont's timeline. Mm-hmm. Is there, competition is the right word, is there any concern that various states are doing it differently? So in a way, as we're trying to create a national herd immunity, Vermont may be ahead of the game, behind the game. Let's assume we're ahead of the game. Are there other places that aren't moving as fast, and is it dangerous, or is there concern that we're not all on the same timeline?
Well, I think it's reality that we won't be on the same timeline because we're not the same. There's circumstantial differences, there's socioeconomic differences, there's urban versus rural, so there's transportation differences. I think where we could, get into trouble is if certain areas really try to prioritize so much to the point that they are slowing down the system and they can't get large numbers of people through. That's where we would run into trouble. I think that in Vermont, we, because of many, many things, including the location that we are, the rural nature, as well as just the folks and the culture here, I think we have the ability to be, at the top of the game as far as getting people vaccinated. And I'm almost certain that will pan out.
Great. Couple more questions on Facebook we want to get to. Stanley asks, how will age groups be notified when they're eligible?
So it'd probably be that's a great question. Probably a release from the state at the same time that the media will release it. Our own hospital will try to get the word out. I don't think people today are so disconnected that they won't find out rather quickly. I also anticipate that if it is done with mostly at the hospitals, in collaboration with the state, that it will be an online registration, but I can't guarantee that because it depends on how the state rolls it out, and they may have their own registration system. Right now, the state does a really good job on testing when they have these pop-up clinics and you register online, so I anticipate it'll be something similar to that.
Nadia on Facebook, her staff are essential workers. She missed the beginning, so we just want to reiterate, when will they be eligible to receive a vaccine? They operate a DV shelter.
So if they are fall into the category of phase 1A, which the definitions there again are healthcare workers, long-term care, and residential, so she may meet the residential, then they can go online and sign up at svhealthcare.org. It's quite straightforward. Our IT department has refined the process. I've hardly heard of anyone having any difficulties. We have had some people try to register who don't meet the criteria, and we have to call them and ask them to hold off. People that are encountering people in shelters, that qualifies as a residential type living, and so they can go ahead and sign up, those staff members.
Great. Just a shout out to Elaine. She followed up with Virginia on Facebook saying she has a penicillin allergy and has gotten the vaccine with no problem. So
great.
Absolutely how we want to see this community work and communicate with one another. Final one on Facebook for now from Robert. What is the best way for 75-year-olds to know when the vaccine will be available to us? I think we've already talked about that there'll be plenty of communication, and it sounds like it may be coming sooner than later. So Robert.
Tell them also, it's a part of their morning routine when they get up and they're, doing their walk and reading their newspaper and having their coffee. They could also log on to our website. I can guarantee within 10 minutes of the planning to start public, we will have that notice on our website. So it's svhealthcare.org, and you just navigate. It's really straightforward. We've gotten rid of everything else because right now this is what is on people's minds, or at least we put everything else sort of in the background.
Right. And Wanda, hopefully that answers your follow-up question around ways to communicate with the community. Be checking svmc.org every single day. Be tuning into telecasts like this. I'm sure our local newspapers and radio stations will carry it as well. She does bring up an interesting thought around physician offices don't always have the most accurate or up-to-date information. So maybe some better coordination with more of the local, smaller physicians. I want to get back to some of our questions, and then we'll hop back over to Facebook. With a new variant strain coming out, and even as close as Saratoga Springs, should we be concerned, and any tips to avoid it other than don't go to Saratoga? Well, including don't go to Saratoga.
Let me just say that if it's in Saratoga, Matt, I think everyone, I don't want to create some alarm that is not called for, but I'm certain it's around here. We don't have the capabilities to regularly monitor for different genomic strains of the virus. I just saw a quote the other day that says in the United States, only about 3,000 samples are genomic sequenced. So certainly it's in a lot more prevalence than we can think about. In fact, if we can just assume that, we can move on and not devote so much worry to it and just assume it's around. Well, what we need to do is we need to do a few things. We need to stick with our current mitigation as hard as it is and say, wow, if it's more transmissible, there's even more of a chance. I've got to wear my mask. I've got to distance. It's not the time right now to have friends over, even if you think these friends are safe. It is a time to say, let's get through this spring and let's encourage as many people as we can to vaccinate. It's more of a reason to vaccinate. I think you've known that there are probably multiple strains, but in particular, there's two that are being followed right now. The B117 out of England is being monitored. That's the one that has an increased transmissibility. And then there's one out of South Africa that people are worried about. And there will be more. It will be very unusual for these strains to be resistant to the vaccine. That's just not typically how things work with viruses. It typically takes a longer period, and it takes pressures from lots of people being vaccinated. And the good news is at that point, we should be able to respond more quickly. That being said, science is watching these things very carefully. And if one does develop that is resistant to the vaccine, then we will have to respond.
Right. So I just want to reiterate and re-say what you said, that, more than likely vaccine will work against some of the variants, that it takes either a lot of time or it takes a while for a virus to think up new tricks to
Right.
get to people when we are all vaccinated. And so, as well as we have scientists looking at this continually. Obviously, it's on the world stage, and everybody is concerned and working on it. So, to not have as much worry as maybe we all have, but to be diligent and to continue to do those social distancing efforts. This has been coming up a couple times on Facebook. I've received a couple texts about this. It's one of our questions. I think let's talk real local at the moment. We've been hearing about increased positive rates in Bennington County. The chief of police was on the Bennington Banner this morning, having had COVID-19. Talk to us a little bit about what's going on here, Dr. Dobson.
Well, it's certainly true that the rates of positive tests for SARS-CoV-2 have increased significantly, really since right after Thanksgiving. And I just have to say it was predictable. We figured it would happen, and when I say we, I mean society kind of figured it would happen, and it has. We also are near the border states of areas that have increased prevalence, so it would be foolish for us to think that we won't have increased prevalence over time. Now, we aren't going up at some rate, at least right now, that you've seen in other locations around the country. And that is because of the behavior of Vermonters and how many people are adhering to the mitigation. That's what's keeping us, right now we're averaging, locally in this area, we have about 15 to 20 cases per day. That's a significant increase, but we would be over 100 per day if we didn't adhere to the distancing and the mask wearing. So a lot of credit goes to there. And just because the numbers are going up doesn't mean we've lost. In fact, we're just keeping it at bay. I will say that there's all of a sudden this attention that says the numbers are going up, but I can tell you they've been up. They've been up since after Thanksgiving. In fact, it's almost plateaued. It has certainly not gone down. We think it'll continue to go up just a little bit now that we've had Christmas. If people can not get tired and continue with the mitigation, then we should be able to keep it under control. If they give up, then we're in dire straits.
So if I'm hearing you, if Vermonters do what they normally do in January, February, and March, which is hibernate and not see anybody anyways,
that's right.
We'd be okay. Thank you, and I think that's important for us to recognize and appreciate you sharing some of those inside things with us. Anything that this community can do to continue to support, I think of as you start to roll out even the clinics, and you're talking about the airport, and you're talking about SVC, and you're talking about Svmc and anywhere else, and up into Manchester. I have to imagine that that's causing a strain on your already strained staff. Are you experiencing, absolutely fatigue, but even just a shortage of nurses and people that can actually apply this vaccine, and also how else can the community come alongside and help you?
So, Matt, unfortunately, we are perhaps at the greatest level since this pandemic began. Certainly, the anxiety and the stress was very high in April when we saw the huge peaks and into early May. But it's come back in different ways. Because the prevalence is higher, we've had more staff who've had to go out, whether it's their own exposure, their own illness, or that of their family. And then it's winter, which means our caseload in the health system is higher. So I think some things the community could do is, first off, we always appreciate you thinking of us. Certainly we're thinking of you. The second is being a little patient and understanding when we have to cut down on staff because people are out, and understand that we have to put rules in place that prohibit visitors. We're trying to protect our patients, and we're trying to protect our staff. I know a lot of people want to volunteer and they want to help, and there may be a place for that when we start these large vaccination clinics. The truth is, it does take training, it does take some standardization, and if people were previously in healthcare, that may be useful, and we may be reaching out to them.
Great, and I know Ray's on the line. You can't see him, but maybe time for 104th 100-year celebration like we did for your 100 years when we're all said and done, with many, many community members pouring up to the hospital to show our love and support for all of that you guys are doing. Some other questions that are coming in. Please help those who live in border states who have primary care doctors in Vermont understand how the rollout will occur with them. Will vaccines be conducted by primary care physicians, or could they come by the hospital or even the pop-up clinics? Are we carding people as they cross the border? Can they come from New York and Massachusetts up into specifically Bennington, because we tend to service those areas?
Right. So, we definitely define our health service area that includes parts of New York and Massachusetts, and they're our patients, and so we would be vaccinating them just the same. We have to be a little careful because we want everyone to be vaccinated, right? I don't care if you're in Hawaii, you're in Canada, you're in Europe, you're here in Vermont. We want everyone to get vaccinated, but it is done in an allocation way. So we would be wrong to use up our allocation for those folks who really should be getting their vaccine elsewhere. But the short answer to this is we don't anticipate, we anticipate more of an honor system. If people live in Hoosick and they use the health system, then we want to vaccinate them. If it turns out that we're seeing a lot of people come from far away, then we're probably going to have to start doing some checking, make sure they're in our system, make sure they actually see our physicians here locally.
Okay. We're going to go back over to Facebook. A couple great questions coming in from Nancy. She has a lot of allergies, flu shot, iodine, penicillin. So is she not a candidate for the vaccine?
Oh, she definitely is. And I want to say, first off, I understand that fear. When you have allergic reactions, it is not pleasant. So what we do is we vaccinate and we watch and we are ready to treat. The folks that, of the 20 folks in the United States who had the anaphylaxis, 17, unbelievably, had anaphylaxis to previous vaccinations. Now, the good news is they wanted to be vaccinated anyway. They did the right thing. They were treated, they were discharged, and they feel great. And guess what? They are protected against COVID, or at least 95% protected, and COVID kills. So for people that have allergies, it is anxiety provoking. Know that that for the vast majority, you will not have allergic reaction to this just because you do to other things. And if you did, we are ready to go to treat you. And that's the same throughout the country. The clinics are ready to treat people who have anaphylactic reactions.
Great. We see some great engagement on Facebook. Sharon had a question about if you've been tested positive for the COVID, can you still get the vaccine? Is there a waiting period? But Amita followed up with your website saying that wait 75 days. So
right.
Can you just confirm that?
Let me explain the reasoning behind that. There's no contraindication to getting the vaccine after you've had COVID. Right now, the supplies are low, so we're asking those who have had COVID within the past 90 days to hold up until about day 75 so that we can make sure to get it to other folks who don't have an immune response like you do. As soon as supply gets higher, then that requirement will go away.
Right, and we talked a little bit about last time that contracting COVID provides you with antibodies for a period of time, maybe a lifetime, but not nearly to the degree of a vaccine. So even if you've had COVID before and you say, "Hey, I'm good," it's still recommended to get a vaccine somewhere in the future.
It is. We know that vaccine gives a predictable response, and that response confers 95% effectiveness. For folks that get the disease, they certainly may have the same 95% effectiveness or above, but they may not. It all depends on how their body reacted to it, what was going on at the time. So that's why we recommend to go ahead and give vaccine. By the way, that's how almost all diseases are as well.
Great. Are pharmacies going to be giving the shot?
They will. It is just what's unclear at this time is when they will begin that. Same with doctors' offices. Doctors' offices will certainly be giving vaccine, but it's unclear when. Right now, with low supply of vaccine, it doesn't make sense to disperse it to the pharmacies and to the doctor's offices because it means that vaccine can go unused. So it is much more efficient operationally to do it in a central location. But rather quickly, it will go to the pharmacies and to the doctor's offices as soon as that supply again increases.
Great. We have a couple more questions for Dr. Dobson with Southwestern Vermont Medical Center. Again, if you're watching on Facebook Live, please leave a comment or really a question if we haven't gotten to it yet today, and we will make sure we pass those along to Dr. Dobson. A couple more here. Is there a reason why the flu clinic structure couldn't be used to get people vaccinated quicker? I think we've said that there will be a flu center clinic structure, and depending on the size and scope and the resources of the hospital, being able to put that in various locations.
That's right. So no, it should be similar. I mean, it's possible if we have a large outdoor tent or gymnasium that it makes more sense for folks to get out of their car and, go into an accommodation. But if we don't, the drive-through is just fine. We just have to observe them, for 30 minutes, 15 for folks, most folks, and 30 minutes for those who've had previous allergic reactions. And we can still do that when people are in their cars. We've done it before. We did it with the flu clinics.
Yep, I was there for that. This is maybe another, I think we've answered this, but this may be another way to frame a question. So I just want to get your take on it. Okay. What is the spread between the amount of vaccine in the state and the number vaccinated?
Yeah, well, so I can't give real good answer to that. I can say it is probably close to 50% now. That sounds like a big difference. And you think, why? What is going on? Well, I'll give an example here. We have 300 doses ready to go, but we're going to be giving those over the next 2 days. So you could say, well, they're not being given, but everyone is scheduled and the clinic is full. So we're ready to give them. And the same is true in most places. Now, you have read about, and it is true, especially early on, there was vaccine sort of sitting and not good administration. It was, again, sounds terrible. It really is, makes common sense. People were trying to learn how to mix and get ready for it. And so we've gotten through those. Vermont's one of the highest, by the way. There were some places, at least early on, that had more like only 10% given, but we're well above that.
Okay. One over on Facebook, what is the certainty of receiving the second shot given that you are dependent on supplies?
Yeah, so that is an excellent question. Nothing in life is certain. I have figured that part out. I can say that we feel very confident that for every first dose given, the second dose is set aside at the state and federal level. And so far, we've started the second doses, and that has come true. In fact, all of the Pfizer vaccine that we've received in the last week is earmarked for that second dose.
Will you start to get kind of two-edged question here? Will you start to also utilize Moderna as well? And are there other ones that you're kind of watching as they're going through the process, just to, again, trying to get as much vaccine into Bennington County as possible in Vermont?
Absolutely. Well, we have certainly started Moderna. In fact, every vaccine given today by chance is first dose vaccine is Moderna. We're given second dose Pfizer today as well. So both of those. There's not another vaccine at this moment that has undergone emergency use authorization. As soon as that vaccine's available, there are, as you are aware, many in the pipeline. The data on them has not been released, so we don't know whether or not they are effective. In fact, no one but a very few people know that. They don't release that data until the end, and there's reasons behind that to prevent bias and ensure good scientific study. One that gets talked about a lot, I think people are aware of, is the AstraZeneca, and then another one is the Johnson & Johnson. So as soon as those become available and are shipped to us, we'll be assuming they are effective, we'll be using them.
All right. Well, I'm just kind of filing some final question here. I think we've answered, is there a vaccine available that hasn't been used? And if so, why not? I think I think the general concept is, at least in Southwestern Vermont Medical Center, you have vaccine, you have them scheduled, you are using everything within your power to do. Talk to me a little bit, Dr. Dobson, just for the audience. What's the purpose of dose 1 and dose 2? And how effective is dose 1? I mean, you're already somewhat resistant after dose 1, right?
Right. Well, you certainly are, but we don't know how resistant because the trial didn't stop with one dose. It went with two doses. So there wasn't an arm of the trial with one dose and an arm of the trial with two. We know that viruses tend to respond, or our immune response tends to do better when you have this initial dose followed at some point by a booster dose. You see that all the time. Tetanus, for example, every 5 to 10 years, you get a booster. Other diseases are the same. And so that was an accident that they said, let's do 21 days and 28. They had some data from laboratory studies to suggest that that was the optimal time. That's what they did. That's the data we have. We have no data on how effective one dose is. And I caution us from going down that route that you've been reading about unless there is no alternative. If there's no alternative, then yes, we would go with the one vaccine strategy, one dose strategy.
Well, I want to thank you on behalf of the all of Southwestern Vermont, including New York and Massachusetts, and all the people that are so dependent on the health system. Thank you to your staff. One final question, Dr. Dobson. What is one of your New Year's resolutions?
Oh, you put me on the spot there, Matt. I think it's just recognizing as there's increasing pressures from this pandemic and increases on myself with the vaccination planning is to recognize what's important in this world, and that's achieving joy and your companionship with your friends and family, and those come first.
Right. Couldn't agree more. In closing, why don't we put up and just walk us through, just for people joining on in the last couple minutes, let's look at the timeline again for the vaccine and just walk us through that one more time for people.
Absolutely. So let me get past this initial slide here. So this again, if you just joined or you weren't here earlier, this is a vaccination timeline, which can vary a little bit based on your location due to supply of the vaccine, as well as state regulations, and then local and regional circumstantial reasons. But so we are in this purple phase, the December to January, where healthcare workers and first responders and staff and residents of long-term care facilities are undergoing vaccination right now. We're a good 2/3 to 3/4 of the way through at this point. In February, we believe that we'll start with age band vaccinations, somehow either in collaboration with the state in large clinics is our best guess. We do hope we'll know information about that within the next 7 days. And in the green part is the one that's also in question, and that's where do people with high risk medical conditions fit in who may be younger and therefore not early on in this age band. And that remains to be seen how we're going to be handling that as well. If supply of vaccine increases, a lot of these questions become moot because we can quickly move through the age band priorities, even in a matter of weeks, which would be fantastic.
Well, on behalf of Southwestern Vermont Medical Center, the Southwestern Vermont Chamber of Commerce, and CAT TV, I want to thank everybody for tuning in from the community. Please, if you have more questions, forward them along on the CAT TV Facebook page, the Chamber of Commerce Facebook page, and we know that Southwestern Vermont Medical Center and their website is great and terrific, always being updated. Check it daily, but leave a question for Dr. Dobson or any of his staff if we didn't answer it today. I'm sure we will be back here sometime, Dr. Dobson, in the next couple weeks. So I look forward to seeing you again. Be healthy, be well, my friend. And again, thank you for hopping on.
Absolutely. You too.